Hi, this is Dr. Teachout, Dansville Family Dental Care. Tori is here, Zin is out there somewhere running, but finally I got one of them here. And he says hi. Anyway, so today I just want to talk to you about two things: cosmetic dentistry and advanced dentistry. Cosmetic dentistry is a collective term for a variety of procedures undertaken to beautify your smile. And that can involve bonding, crowns, bleaching, veneers, all those terms that you hear about. So that's what it makes it beautiful. Advanced dentistry is a collection of terms for a variety of procedures that make you smile to enhance and let's put it that way. It's a variety of procedures that can be done for those smiles that has fallen on despair. On the smile that, for example, you have missed some teeth or have had, crooked teeth, and or you require like a more advanced treatment, okay? So, for example, if you're missing teeth, so you may want to consider, implants, and that's how the implant look like. You can construct a bridge supported, implant supported, or a single tooth, so that's how it looks like, in your mouth. And that's trying to mimic exactly, existing tooth. So this is the part that goes on your bone, and then on the top here there is another screw that would hold the crown. So there is three parts of the implant: the root part, the abutment part, and then the crown part. But of course the implant is not the same size as the root of your teeth, because the implant is smaller in some of the teeth that you have in your mouth. So, but that's just a summary version of it for you to have an idea. So those are the things that can be involved in advanced dentistry. And that could be included in a full mouth rehabilitation when you're missing several teeth, and there's a very complexity to be achieved, to bring you to a very optimal smile, and also to a good function as well. There is also what's called all-on-4 implant denture. So that's, several implants it's placed in, and the denture is placed on the top of it. And also you can have, for example, several full mouth rehabilitation when you start from your teeth has been wear fastened due to bruxism for grinding your teeth, and you have lost a lot of the structure of your teeth, and may require those advanced procedures. But that's all. I can talk about all that with you when you come to my office. Anyway. So, but if you do decide to come, this is how your first visit look like. First, you can check me out on my website, which is teachoutdental.com, and you can take a tour of the office and meet all my team, at least see who works with me, and they will treat you as a king as soon as you walk to the office. Each one are able to listen to your concern and to your desires, and, make sure that I am aware of what you're looking for. So as a first visit, I usually have a full set of x-rays, unless if your x-rays is updated and you bring from another dentist, so then I can use, but sometimes I take my own film just to make sure that I have the perfect view of what I need to diagnose any possible, condition on your teeth. Then after that, I'm gonna do an intraoral exam and an extraoral exam. My intraoral exam, I look at all the teeth, all the soft tissue, the tongue. I do a testing as well for cancer. I offer you screening for cancer, and other concerns that you may have inside your mouth. Then I'm going to do an extraoral exam where I'm looking at the facial contour, if it is a symmetric situation, if it is, look at this, went to sleep. If there is any concern outside that I may have, especially regarding your TMJ, your temporomandibular joint. So I check your joints for any possible clicking sound, or any pain or discomfort in your muscle and neck. I will also check your neck, focus on the salivary glands, any palpable lymph nodes, as well, any possible mass or or any possible cysts that I may find, you know, on your soft tissue. And that's what it consists. And then I go through your x-rays and I try to design a treatment plan that fits you, that is address your concern, your desires, and more important, that fits your budget. And we will sit and go over what will work for you and try to design, you know, a treatment plan that is achievable. It might not be achievable all at once, but it might require a little bit of time for us to get to the end of it, but in both situations, so we'll be able to talk and go over in details with you. And we also talk about, you know, payments plan according to your, you know, capability, or if you're ready, we can actually start the treatment right there and then, if that's, you know, something that you would like to. Otherwise, you would be coming back and we're gonna have to do, we will go over any detail that you may, you know, have any more concern. But that's what it looked like a first visit with me. I'll show you pictures, you know, I do several intraoral camera pictures because I want you to see what I see and address your needs and address any possible, you know, pathological situation that I might see and you might not be aware of it. And with an intraoral camera, I can show you that easy. Anyway, so check us out, give us a call, and we'll be able to help you out. Again, this is Dr. Teachout at 585-335-6170, Dansville Family Dental Care.